Good morning students. Today we will see about what is digestive system, anatomy of digestive system. So most of the questions really like tongue, about salivary glands, about stomach, most of the questions are coming, possible questions mostly coming from the digestive system. Some tactics I will tell you how you have to remember. Digestive system is like a canal. It has both ending or opening from the mouth to anal canal, right or not? It is a long canal. The digestive system, the total length will be about nearly 30 feet of the length is there, and also it is also secretes some of the hormones, and it also secretes some of the fluids. The total digestion process will be taken place nearly 36 to 48 hours. So the food is whatever the hard substances coming from the saliva to various enzymes are secreted with the influence of the this one, not by the hypothalamus, that's why we are telling digestive system is like a second brain. Once the food is passing, how the food is going to convert, what is the name of the food over here, once it is coming, what when it is going here, what enzymes, what is the protein, what is activity is going on, how the digestion takes in place, how it is absorption takes place. That's what we are going to see in this digestive system. Before going to see this digestive system, you should know what are all the parts of the digestive system, as well as before you have to know the like a region of the abdomens. Okay, because in anatomy we will be telling anteriorly, posteriorly, superiorly, laterally, what all the organs are present and which area. The stomach means where the stomach is presented. So where it is presented, it's the umbilical area or the left like hypogastric region, or where the will be coming epigastric and the umbilical region. The stomach is really present. What is the shape? What is present laterally, like that? If you divide the abdomen into, this area is called the epigastric area. This is the umbilical area. Right hypochondrial, left hypochondrial, right lumbar, left lumbar, right iliac, left iliac, then suprapubic area, hypogastric area. So this is the region of this one. So if you want to draw the stomach, you can come here. It will be drawn the stomach and the umbilical area. 1/3/4 of the stomach is coming in this area. Understand? So if you see, first will be the digestive system starts from the mouth to the anal canal. If you see the mouth, what in the mouth we have, what is there? First it is to the lips. Understand? So the lips, if you go, there will be a tongue is present. Tongue is playing a very important role in the digestion process. It is composed of the voluntary muscles. It is the base. It is present in the hyoid bone. Understand? This is it is lined by the some mucous membrane. It is also lined by the squamous epithelial cells are really lining. The tongue is full of papillae. That we detailing we will see what is the tongue is made up of. What the tongue is made up of, like the papillae are present. There are many papillae are present in the tongue. There is a circumvallate papillae. There is a few number in this V-shaped structure which is present. Tongue alone, if they ask you, you can draw this picture and write it. This is called the circumvallate papillae, where there is a nerve fibers and nerve endings are also present over there. Then will be fungiform papillae and the filiform papillae. This filiform papillae, there is no taste buds are present. This is the dorsum of the tongue. Understand? This is the blood supply. Also venous return also present. Nerves will be the hypoglossal nerves will be also supplying, and also by the fifth cranial nerve also supplying. Glossopharyngeal nerves are supplying. Seventh and ninth cranial nerve, hypoglossal nerves. So these many nerves endings are present. So the tongue also, there are various area present there. So this is in this this one is the tonsils are present. So the both the sides are tonsils are present. But this is the really structure of the tongue. You can draw this one. Okay, then will be, this is the epiglottis. This is the linguinal tonsils. Parotid tonsils are present. If you see the area of the tongue, the area you can divide the bitter area, sour area, salt area and sweet area. So these are all the areas of the tongue. If you see this is the beginning part of this one is called the mouth. Mouth, you could see the teeth, and the skin fold is called the vulva, isn't it? Soft palate. This is a pharyngeal arch will be there, and this side you can see the tonsils and the teeth are present. So what is teeth? Teeth, how you can divide the incisor teeth and the molar teeth. Then what is the function of tongue? You draw the structure of tongue, blood supply of the tongue, nerve supply of the tongue. What is the papillae are present? What is the function of tongue? The function of the tongue mainly by the chewing the food and the swallowing the food. It is also helpful for the speech and taste buds. So it is useful for the taste. So in the teeth, if you see, what is the parts of the teeth? If the 5-mark question is coming as a teeth, what will we do? You will write the structure of teeth. In the structure of teeth will be the first is a crown. This is called the crown. From this area to till the neck is called the crown. The outer side is called the enamel, and the inner to the enamel is called the dentine. And this is the bony prominence where the teeth is being embedded. In the bony prominence, this portion is called the pulp. So inside the pulp there is a cavity. So the bulbar cavity. In this pulp cavity there is a nerve and other endings are present. Nerve, blood supplies and other things are present. In this layer it is covered by how it is enamel is covered. This is called the centinum. Then will be the blood supply will be there. What all the arteries are supplying over here? It is in the maxillary area. So the maxillary area. So number of veins are drained, and the number of vein drained, and these vein drain into the internal jugular vein it is going. So teeth are different types of teeth, incisor and the molar and premolar teeth. If you applied anatomy of this one, you will be seeing about gingivitis, glossitis. So inflammation will be coming in the gum disorders will be coming. Okay. In the lips, some peribary like some vitamin deficiency disorder will be there, called applied anatomy. So when they are asking for the 5-mark question, you just draw the picture, marks the parts and explain in a small letters and write about the arterial supply and the vein supply and the applied anatomy. Next we will see about the salivary gland. Short notes on salivary gland. Just you draw this small picture and write it about we have a parotid gland. You know saliva, how many amount of the liters of saliva is present, secreted nearly 500 ml to 1.5 liter of the saliva is secreted per day. How it is initiated by secreted by the smell of the food, by thinking of the food, by the food, the mouth, the food is coming into the mouth, it started to secrete. You smell the food, it is coming. So this is the various glands which is secreting, that is the parotid gland, and then down here it is the sublingual gland, and this is one is called the submandibular gland. What is the cells which is around? The glands are surrounded by some fibrous capsules. It consists of number of cells. Acinar cells also present, and inside that there is a secretory cells are present there. These secretory cells are secreting this one is called the saliva. So this saliva which is very much helpful to convert the food into the form of the bolus. So how the bolus is, when the food is coming to the mouth, the biting teeth, incisor will be biting, and the molar, premolar will be grinding teeth. They grind it with the help of the saliva, the formation of the substance of the food which is called the bolus. Now one physiology question. What is the composition of saliva? Saliva nearly mainly by the water, and will be the mineral salts also will be there, and also having a salivary amylase are present. These amylase are the digestive amylase, and mucus are present, and then some antimicrobial substances also present. These enzymes are called the lysosomes. This also will be having killing of some of the bacteria. So physiology of secretion of the saliva, how you will write? It is controlled by the autonomic nervous system and parasympathetic stimulation of the nervous system. The reflections, as I told you, by the smell of the food, what will happen? So the smell of the food will be, it's initiated, it is started to secrete the saliva. How the functions of saliva? The saliva, there is a chemical agent. So it will be helpful to enzyme amylase will be helpful to digest the carbohydrates. Understand? And also this saliva will be helpful to lubricate the food. Dry food you are putting, the KFC chicken you are eating. So what will happen? First it will be coming and moisturizing and grinding, it forms the pholas. Clear? So this is about the bolus. This bolus will be help of the tongue. It will be pushing. Then it will be going to the esophagus. So we saw how the bolus is going to the esophagus. There are many short notes on bolus formation. How the bolus formation will be, you can tell that many things will be, the bolus formation will be oral phase when it is in the mouth, it is a oral phase, and the pharyngeal phase, and then esophageal phase. Oral phase where here the food is coming, here and then mastication will be taken place, grinding of the food, and then the bolus dorsum of the tongue will be pushing the food into this one and move back to the pharynx. So this, once it is coming to the pharynx, the pharyngeal phase is started. So the pharyngeal phase, this pharynx is the common place where the food and air will be going. When the food is passing, the respiratory path will be closed by the leaf-like a structure is called the epiglottis. The pharyngeal wall contracts, and then what will happen? It will initiate the pharynx to open, and then there will be a relaxation. The food will be pushed into the pharynx and it goes to the esophagus. So how the esophagus is moving? There is a esophageal sphincter is also there. There is a movement is called the peristaltic movement. The pharyngeal peristaltic wave will be passing from the esophagus, and they travel downwards and reach to the cardiac sphincter. So when the cardiac sphincter, esophagus sphincter will be closing and it will pass through the cardiac sphincter. When the cardiac sphincter will be opening, the food is going to the stomach. Then will be by the secondary peristaltic. The similar primary peristaltic occur. Same will be, it will be enter into the stomach by the initiated for the digestion. Understand? So there will be so what will happen here? The food bolus formation means, you write what is definition of bolus, and bolus formation by 3 stages: oral phase, pharyngeal phase, esophageal phase. So by the peristaltic movement it is going over here. So that much you have to tell about this. Next, the food passage is called the esophagus. What is called esophagus? Esophagus is a round muscular tube. It is nearly about the 25 centimeter in length. It is started from extending from the lower border of the cricoid cartilage. That means C6 vertebral column, and it extends till to the T11. Okay, T11 is esophagus will be continuous with the pharynx above, and it ends with the joints in the stomach in the below. The upper portion of the esophagus having the sphincter is called the esophageal sphincter, and the lower portion will be, this esophagus will be having a cardiac sphincter. The arterial supply mainly by this, you can see this picture very clearly. So this is the esophagus. Okay, this is the aorta, branch of the down portion will be having the diaphragm. So aortic branches of the aortic artery, left branch, this is the thoracic part, is called the thoracic aorta. Here will be the abdominal aorta. Here will be the venous drain, it will be drained into this IVC. So these arteries are called the paired esophageal arteries, will be supplying the branches of the in the abdominal. This will be esophageal artery, and the branches from the inferior phrenic arteries will be then gastric branch from the gastric, that will be gastric celiac arteries also will be branches from this abdominal aorta. Each areas this will be supplying this one. Understand? So what is the applied anatomy of this? Sometimes the esophageal atresia will be coming. So due to some cancer or anything may be affecting the esophagus. Next we will see about the pharynx. The pharynx we have to see here in the digestive system, because it is a both common passage for the food and air. The pharynx is a muscular tube. It is nearly by the 12 centimeter in length. It is extending from the base of the skull to the 6th cervical vertebra. It is continued with the 3 parts. It is called the nasopharynx, oropharynx, and will be the laryngopharynx. The nasopharynx, which is behind the nasal cavity nasopharynx, also it is extended from the skull to the level of the soft palate. Okay, and then nasopharynx continues with the oropharynx. So the oropharynx will be the lies in the posterior part of the oral cavity. This is the anterior part of the oral cavity. This is the posterior part of the oral cavity. It extends from the soft palate to the cervical vertebra. It opens in the oral. So later it has called the tonsil sciences, palatine tonsils, other things are present. The laryngopharynx will be present. So it's then will be the laryngopharynx. Laryngopharynx lies behind the larynx. It extends from the third to sixth vertebra. Okay, so the lateral primiform fossa will be present there. So mainly by the venous drain by the thoracic region by the left vein will be the left gastric vein will be there, and venous fluxus will be supplying the link. So this is about the pharynx. You have to tell there is nasopharynx, oropharynx, laryngopharynx. So 3 kind of the pharynx are present. Okay. So this is about the small introduction about we have seen from the mouth to about the esophagus we have seen, and also the pharynx in detail we have seen. In the next video we will see very important thing about the stomach and the small intestine. So in the stomach, what is the structure of stomach, what all the hormones are secreted, what all the enzymes are there, how the many hours food is present, like that we'll see in the next class. Thank you.